Hi, my name is Dr. Cary Gans, and I am both a practicing prosthodontist here in Garden City, New York, as well as president of Dental Spa Cosmetics. I wanted to take a moment to talk with you about a profession that has been very good to me and my family for over 30 years. During that time, I've seen dentistry change. Over the past years, we have seen the bonding of materials to teeth. We've seen teeth replaced by highly successful dental implants. Truly a remarkable technology. We can now fix, correct, alter cosmetically even the most difficult cases with both prepped and non-prepped veneers. Patients no longer have to struggle with cosmetic abnormalities. We can even whiten teeth in a visit or two. However, what has not changed is the way we actually practice dentistry, and by that I mean patient relations. Today, in most cities around the country, dental management consultants and coaches are still espousing the same management styles we were taught over 30 years ago. Yeah, sure, today instead of a pegboard with colored pencils and using red and blue to denote different appointment styles, we have PCs and Macs. Today, instead of calculating our accounts receivable on a calculator, we can use products like Microsoft Excel. But if you think about it, in the day-to-day way we manage the patient experience, not a lot has changed in all those years. Things are pretty much the same. Now today, even more important than years gone by because of the tough economic climate we're currently in, we need to be better than ever before in the way we provide customer service. Patients, much like customers in any business, have options. They can go on a trip, they can buy a new car, or they can have the cosmetic dentistry they probably want and need. When they have to select a dentist, they can go to any number of dentists that can prepare a tooth and cement a crown. If your office looks and smells like the office down the street, why should they choose you? Because patients just don't know the difference between a good margin, great occlusion, and the curve of Spee. What they do know is how they are treated in your office from the moment they arrive, while they are in treatment, and when they leave. I would suggest that most dentists today provide a pretty good dental experience. Most offices provide coffee and tea, maybe some cookies and cake. They call their patients the night of treatment, and they probably give their patients pens, pencils, toothbrush, floss with their names on it, the dentist's name on it, when the patient leaves the office. Now, would you consider this to be a great or exceptional experience? I would suggest to you that this is good, but not great. And Jim Collins, in his book, Good is the Enemy of the Great, states emphatically that even though you may be good, this may be detrimental to your practice. You need to be great. Now, to be great, you need to be unique. You need to be different. You need a unique selling position. It needs to be exceptional, your customer service, in the eyes of your patient. When they leave your office, when they are at dinner that night, or at a meeting that afternoon, they must be jumping to talk about how great your office was. You need to create the dental missionaries of years gone by. To do this, you need the Sourire experience.